I started my career as a clinician. That gave me this kind of very insider view on what the healthcare IT actually is. I have worked as a clinician in many of the big hospitals in Finland, but also in Sweden. So today at Tietoevry, I lead our work in clinical solutions based on open standards. And basically, if I'm not talking about scalable clinical solutions, you can find me on my road bike or skiing. Yeah, so in healthcare, the success doesn't come from technology. It comes from people, and especially people when we are working together. Our approach has been simple. We co-create, and that means clinicians, IT experts, and patients are at the same table. So it's about partnership, asking the right questions, sometimes even the hard ones, of course, and making sure that we stay responsible, but also that we stay agile. So that's how we build solutions that actually work in real life. So I don't know how many of you are familiar with Tietoevry, but we are the world leader in openEHR-based EHR systems. And that's why in my role today at Tietoevry Care, I make sure that clinicians are never left out of the design processes. One very practical way how we do this is that we make sure that we are all in the same table, and we have established these partnership models where we work together with our customers to decide what to improve and when. And this all starts even from the strategy level. So if we think of an iPhone, so iPhone wasn't just like a better phone. It actually changed how we live and how we communicate. And I strongly believe that this is the kind of leap we need to take in healthcare IT. So for decades, we have moved from very siloed system to monoliths and then to fragmented modules and so forth. And I think now it's the time that we take this big leap in healthcare IT to move into open modular ecosystem and actually start transforming the care. And this is actually where openEHR comes in. By giving us this like regulated and modular data model that frees us from the monolithic limitations. And with this foundation, we can shift the focus from the systems to the people and designing real applications that support the clinicians and then benefit the patients. So next, I would like to focus on two of the most important steps of the co-creation. So with all kind of innovation, it has to start with the clarity in the beginning. We have to start by asking, what's the problem? Who has the problem? When did it happen? And how does it affect the organization? So when we co-create, these questions have to be asked by clinicians, by IT, by the management, but most of all these together. That will then give us a backlog. Oops, it's changing here also. That will give us a backlog of real problems that we want to solve. And because we have openEHR as our backbone, that gives us this like stable foundation that we can then turn into real solution without that we have to reinvent the wheel all over again and again. If we skip this identifying challenges part, we have seen this in real life that there is a big risk that we keep repeating the same problems that have been in the healthcare many times before. So I would really like us to focus and put time and effort on this phase. From our experience, this is usually the change, which is because we are in a hurry, we have now the fundings, customer is, or we are all in a rush to get things done. this is also the part where we skip easily, or where we start kind of taking the shortcuts. But that's usually when the mistake starts to happen already. So once we have kind of identified and prioritized the initiative, we have to move into real co-design and validation. The concepts and the prototypes have to be created for the clinicians, and they have to validate them in real scenarios. And this is where the strategy has become like very tangible, and because the validation happens early and often, we avoid kind of wasting time and money in the process. So users are seeing the feedback, shaping the solution, and that is building trust and ownership for the clinicians. When the clinicians have the ownership, then it's also when they are actually starting to use the solution, they feel this ownership, and it's the change management process is a lot easier. And because of openEHR, again, it has enabled that our clinical applications, we have been enabled to test them and go back to the back office, do development, rebuild it. But because the data layer is stable all the time, we can fail and redo, and this is very, very fast. And we don't basically break the system when we are doing the validation. Also with the validation, we can already start measuring the impact. And if we in the validation phase see that okay, this solution is not having a real world impact, we can then do the real consideration whether we should kill it already at this point, or if we still want to implement it. In healthcare, of course, not every challenge can be solved with a quick low-code app. In healthcare, really the safety and the reliability matters. And this is why the partnership way of working and co-designing helps us to balance with the agility and responsibility. So together with our customers, when we decide that which problems can be solved with lighter tools like low coding, no coding, and which then require regulated, robust application. And because of openEHR, these both worlds can live side by side and interoperate safely and efficiently. And of course, reliably also. So a little bit about the background, what has happened in Finland. So in 2023, I think many of you have heard, but Finland underwent like very ambitious transformation. In a European level, we created 21 well-being service countries, and today they are responsible of the whole healthcare, social care, and emergency services in Finland. By that time, 8 of these well-being service countries decided to join forces and create this kind of cross-sectoral digital health network based on shared principalities. They were openness, collaboration, patient-centered care, and the goal was to overcome this long-standing fragmentation between social care, primary care, and hospital services, and address the challenges with the aging population, workforce shortage, and the budgets, of course. So this is when we established the life care partnership model. So this is one very concrete example of how co-creation can be organized in practice. So in Finland, we have the life care partnership model that brings the system developers, the clinicians, the information managers, the CIOs, and even the patients sometimes together from 8 well-being service countries. Today, these eight well-being service countries support services for over 1.4 million people, and they cover around 50,000 clinicians. We have seen a big impact in this collaboration. The clinicians feel that they have been listened for the first time, which is quite sad. We have seen better usability, faster rollouts, definitely more predictable costs, and less manual work. I'm definitely not saying that this is the only way of organizing co-creation, but this has been a very successful one. And there is of course other good ways to organize it depending on the content. But this has really shown the potential. So when we work in a true partnership, the benefits are significant, both for clinicians and the patients. And if we look at or talk about the benefits, let's look at the very concrete example. So yearly we start from the very kind of strategy level with our customers. Finland has a very high rate of diabetes, especially type 2 diabetes. And we chose this diabetes processes as one of the key objectives a couple of years ago. So together with our clinicians, we tested and validated the improvements we made to the system. So it was basically clinical documentation tools based on openEHR. And we were able to do significant improvements to the process. The very important thing here is to understand that the clinicians were using this traditional EHR system before. So basically that was paper-based, and as we all clinicians know, that nothing is faster than working with the paper and pen. That's like for sure. And what happens very often when you move into this kind of modular new systems with a lot of structured data, the work actually with the computer increases. You will get more clicks, more manual steps, and so forth. But we were actually able to reduce them, and this is truly because of the partnership. I think one of the biggest success factors in, for example, this one was that it wasn't only about the partnership between us as a vendor, the clinicians and the system developers and everybody, but that the clinicians from different organizations actually sat together and thought about from the ground that what has to be done, what has to change, and how we will do it. So I truly believe that us IT vendors, we have to take a bigger role on facilitating even this type of collaboration. So not only the collaboration between us and the customers, but truly the collaboration between the clinics. Yes. Another little bit different type of innovation cooperation we have experience on is this 3-month Innovation Challenge project carried out by the Basel University Hospital. So we engaged both the management and the clinicians throughout the project, and we selected a use case within the emergency department, focusing on improving workflows of an elderly patient. So the primary goal was to build a shared understanding and foster true co-development, demonstrating how our Tietoevry clinical modules could enhance the emergency department operation in a real-world setting. So basically, in practice, we took our clinical applications to a totally new context, to a totally new market, and then we start looking at, okay, how we can with these applications enhance your processes and how they fit in. We were able to test the whole emergency department within 3 months, and we saw that these applications, or we proved that these applications actually scale from country to another, but also from very different type of emergency setup to another. Then, of course, the natural next step after the innovation challenge was to do a technical validation together in the ecosystem and test that this multi-vendor ecosystem actually work in real life. Yeah, so for the ending, I would like to leave you with 3 kind of key takeaways. First of all, we need to use open standards as a foundation, otherwise this won't work. The second is that we need to use co-creation as a method. So technology works as long as it's been shaped with the people who actually use it. And the third one is that we have to measure the real world impact, and we have to start measuring it from the beginning. So it's not enough that we measure once the implementations have been done. We have to take the measurements part of the process in the very early stages. Yes, so let's keep in mind that even we all love the technology, that the technology is never a hero. Our people are the hero. And our job here is to make sure that the technology empowers the clinicians and the patients so that they can shine. Thank you.